Cancer, a word that evokes fear and uncertainty. It's a disease that affects millions worldwide, striking seemingly at random. While cancer can arise in any part of the body, today we'll focus on a specific type: endometrial cancer. This type of cancer originates in the endometrium, the lining of the uterus. The uterus, as you may know, is where a baby grows during pregnancy. Endometrial cancer is often referred to as uterine cancer. It's important to note that not all uterine cancers are endometrial cancer. Other types exist, such as uterine sarcoma, but endometrial cancer is the most prevalent. This form of cancer primarily affects women after menopause, although it can occur at any age. Early detection is crucial in the fight against endometrial cancer. When diagnosed in its early stages, endometrial cancer has a high survival rate. This is why it's essential to be aware of the signs and symptoms and seek medical attention if you experience any unusual changes. We'll delve into these symptoms in detail later. In the following sections, we will explore the causes, symptoms, diagnosis, and treatment options for endometrial cancer. Armed with knowledge, we can empower ourselves to make informed decisions about our health. While the exact cause of endometrial cancer remains unknown, researchers have identified several factors that can increase a woman's risk. One significant risk factor is exposure to estrogen. Estrogen is a hormone that plays a vital role in the female reproductive system. When the balance of estrogen and progesterone, another female hormone, is disrupted, it can lead to an overgrowth of the endometrium, potentially increasing the risk of cancer. Several factors can contribute to this hormonal imbalance. Obesity is a major risk factor, as fat cells produce estrogen. Polycystic ovary syndrome, or PCOS, a hormonal disorder characterized by irregular periods and cysts on the ovaries, is also linked to an increased risk. Early menstruation, before age 12, and late menopause, after age 55, can also increase exposure to estrogen over a woman's lifetime. Genetics also play a role. Women with a family history of endometrial cancer, particularly in close relatives like a mother or sister, are at an elevated risk. Certain inherited genetic syndromes, such as Lynch syndrome, also significantly increase the likelihood of developing the disease. It's important to note that having one or more of these risk factors does not guarantee you will develop endometrial cancer. Many women with these risk factors never develop the disease, while others without any known risk factors do. However, understanding these factors can help you make informed decisions about your health and discuss any concerns with your doctor. Early detection is crucial in the fight against endometrial cancer. Being aware of the symptoms and seeking prompt medical attention if you experience any unusual changes is vital. While some women may experience no symptoms in the early stages, the most common symptom is abnormal vaginal bleeding. This abnormal bleeding can manifest in various ways. It may present as bleeding between periods, heavier periods than usual, or bleeding after menopause. Any bleeding after menopause should be considered abnormal and warrants immediate medical attention. Other symptoms may include pelvic pain, pain during intercourse, or a watery or blood-tinged vaginal discharge. However, these symptoms can also be indicative of other, less serious conditions. It's essential not to self-diagnose and to consult a healthcare professional for any unusual symptoms. Remember, early detection significantly improves the chances of successful treatment. If you experience any of the symptoms mentioned, don't hesitate to schedule an appointment with your doctor. Diagnosing endometrial cancer typically begins with a thorough medical history and pelvic exam. Your doctor will inquire about your symptoms, medical history, and any family history of cancer. The pelvic exam allows the doctor to physically examine your reproductive organs for any abnormalities. If endometrial cancer is suspected, a biopsy is usually the next step. This procedure involves taking a small sample of tissue from the endometrium for microscopic examination. The sample is then sent to a laboratory, where a pathologist will analyze it for the presence of cancer cells. Treatment for endometrial cancer varies depending on the stage and grade of the cancer, as well as the patient's overall health and preferences. Surgery is the most common treatment, often involving the removal of the uterus, fallopian tubes, and ovaries. Other treatment options include radiation therapy, which uses high-energy rays to kill cancer cells, and chemotherapy, which uses drugs to kill or slow the growth of cancer cells. Hormone therapy may also be an option for some women, especially for advanced or recurrent endometrial cancer. Remember, early diagnosis and treatment are crucial for a positive outcome. If you have any concerns, don't hesitate to reach out to your healthcare provider.